Well, now for our newsmaker on the show today to talk about the latest on the pandemic, the different variants, and also the latest vaccine news, we're now joined by Dr. Prabhat Jha, epidemiologist, Director, Center for Global Health Research. Thank you so much for joining us. Now, what can you tell us about the situation in Canada first and foremost in terms of the virus and the vaccine program?
The virus is not under control in Canada still. We've had a significant second wave. The first wave was reasonably modest with less than 3% of the Canadian population getting infected. The second wave looks bigger. Only in the last 2 weeks or so is there a reduction in the cases and hospitalizations. And the vaccine introduction has been quite slow. Certainly not at the pace, for example, the UK has been able to achieve. So we still have a lot ahead to be able to get in front of this epidemic in Canada.
And what is your view on the variants that have emerged and have been identified in various parts from the UK, South Africa, Brazil? How worried are you over that, and can we expect more dangerous mutations?
My main concern is not so much for the mutations emerging here, but emerging, or in high-income countries, but emerging in places like Brazil or South Africa or India. In those settings, there's clear evidence, for example, in Brazil, that they had large levels of infection in one city, and then the infection came down, and then they had a big second wave, which very much seems to be due to the mutation. So mutations in areas where there's very little capacity to detect them, such as in India, would be a real disaster. In Canada or in the UK, despite the mutation, the overall trends for the last 2 weeks seem to be positive.
All right, so now currently the vaccine programs are moving ahead in developed nations, even though, they're a bit slow, but there's also a worry about poorer countries, developing countries that don't have enough access to vaccines.
You cannot have a global solution without having all countries share in the vaccines. The vaccines don't respect borders and they don't need passports. Let me rephrase that. You cannot have a global control without having control in every country. The virus certainly does not need a passport to cross borders. And as we've seen, you cannot control the situation, even in a place like the UK, without having control in all the countries that might send visitors to the UK. So we really do need a global solution. I think vaccine nationalism is emerging as a big disaster for not just the developing countries, but also for the richer countries.
And what is your opinion now of a coronavirus situation in India? Earlier, when we had spoken to you right at the start of the pandemic, you insisted that you must count the dead to know really the extent of the disease. Now, at least in India, it seems that the coronavirus situation has come under control, at least in the cities.
Well, you have to look at India in different ways. You have to look at urban India as quite distinct from rural India. So in urban India, the evidence from particularly the big cities seems to be very much that the cases and the deaths are coming down. And in a city like Mumbai, which has reasonably good certification of deaths, that confirms that the trends are generally positive. However, of the 1 crore deaths that occur in India, 7 lakh occur in the rural areas, in the villages, and at home. And therefore, the causes of death are not known. And these large parts of India, we simply do not have information that COVID is under control. We think it might be coming down along with the urban areas, but we simply don't know. We're guessing. And for many months, I've been encouraging the Registrar General of India to restart their survey, which is called the Million Death Study, which would give accurate information on what's happening in rural India. Right now, we don't know. We're simply guessing.
Now, there are various theories about, why the numbers in India have come down. There's some talk of local herd immunity, maybe in the cities. There's also talk of cross immunity because we have so many infections every year. What is your view on this?
The truth is we do not currently know. The reason that the numbers have come down might be several. First of all, in the big cities, it is true that upwards of 50-60% of people might have already been infected. Secondly, it might be that those in those cities that have not been infected might have some biologic immunity for reasons that we do not know yet. But you have to be really careful here. This virus doesn't simply go up and come down. It has different waves. And as we've seen in Delhi, there was a big wave of cases and deaths in June, but a second wave in September. And other settings also show multiple waves. And it might well be that when the hot months come and more people crowd indoors, the infection and the death rates might again go up. So you cannot say that India has turned the corner completely. The epidemic varies by different localities, and the reasons for this are not known. It's a dangerous idea, however, to think about ideas of herd immunity simply because we don't understand it. And herd immunity is more wishful thinking than science currently.
All right, this much touted, herd immunity that we've been hearing from the beginning of this pandemic. But what about the issue of long COVID and post-COVID impact? Do you think we know everything about that yet? There are so many people who have, prolonged illnesses, so many people who suffer from various problems after having recovered from COVID.
The virus continues to surprise us, and it has, obviously, it's going to evolve and mutate as all viruses do, depending on how many people are infected, and even the introduction of vaccines will also lead to changes in the virus. The consequences of the virus in different populations remain largely unknown, and what is needed is very robust epidemiological studies that are done continuously, and very importantly, are open and available for public scrutiny. Lots of skepticism can arise when data are gathered by governments and not transparent or not having undergone scientific scrutiny by others. So this idea that the government can release a study and say, trust us, well, people won't until the details are available of all of these studies. So I think both things are needed. You need more studies and you need more transparency and openness in what those numbers show. That in turn will build public confidence to understand the virus and will also reduce hesitancy about vaccines.
And speaking of vaccines, what is your view of the vaccines so far that have been made available? The good news is that the Russia vaccine has a very good efficacy. Earlier there were misgivings, there wasn't enough data available, and now this is a vaccine that we're expecting here in India. So your view on that?
I think people should listen carefully to what scientists and not politicians say about the vaccines. I personally have great confidence in the AstraZeneca and the Russian Sputnik vaccines. Why? Well, they have both undergone quite a high level of scientific scrutiny and publication and availability of data. By contrast, the Indian Covaxin does not have the comparable scientific scrutiny till now. Now, if this changes, then my opinion about the Covaxin might also change as a scientist. But the AstraZeneca, the Russian Sputnik vaccine, I would certainly take and give to family members. As you said, for logistic reasons, the Pfizer and Moderna vaccines are not practicable for the whole of India. But these other vaccines, the AstraZeneca and the Sputnik, are widely practicable.